MRI Linac by Nathan Cortez. What is MRI Linac? Well, it's essentially the combination of MRI and radiotherapy. And MRI Linac stands for Magnetic Resonance Imaging Guided Linear Accelerator. And MRI means Magnetic Resonance Imaging. And these two things combined are used to treat cancer patients throughout the body. And they have a specific advantage for soft tissue tumors. How's it integrated? Well, I would be responsible for maintaining the machine and also for protocol implementation, training medical dosimetrists, the ones who would give the patient the radiation dosage, and also interpretation of imaging techniques. Before MRI Linac. Before, it was just traditional MRI and radiotherapy. They weren't combined yet, they were their own separate things, and this turned out to have a higher risk to radiation exposure for patients and workers. Not good. And here's how it evolved. Like I stated before, it's a combination of MRI and radiotherapy, and because of this, it is now much easier to track the infected area. And because of this, that means there's less radiation exposure. Here are some advantages. Improved efficiency, more accurate than an MR-CT fusion, and the ability to contour dominant lesion boos on MR. And here are some disadvantages. The need for a backup plan. Because this technology is still very new, there hasn't been some universal backup plan developed yet, but I imagine there will be one in the future. More electron density information, essentially it's more complicated, and the lack of capacity on wide field MRI. Usually most cancer centers only have one of these machines, so it's imperative that it's kept up and running. The future of MRI Linac. Well, definitely it'll become more available, and it'll eventually have the ability to determine a future affected area for a cancer patient, and it'll be more cost effective. How do I feel about MRI Linac? Well, I definitely think it's a breakthrough for the medical field, and that it's another step closer to eliminating cancer, and it provides more learning opportunities. Conclusion. Well, I definitely think it needs to be more readily available, but it's a step in the right direction, and it might be a challenge to learn, but overall, I can't wait to be in the field.